For our next story, let's talk about cancer. It's a leading cause of death worldwide. It accounted for nearly 10 million deaths in 2020. That is 1 in 6 deaths the world over. Cancer is a global health crisis. For years, scientists have been developing vaccines that can fight cancer. Now, Russian President Vladimir Putin has made a big claim. He says that Russian scientists are close to the goal, that they're creating vaccines for cancer, which could soon be available to patients. Will Russia win the race to develop the vaccine? Who else is on track? And why haven't we cured cancer yet? Our next report tells you.
Yesterday, Russian President Vladimir Putin spoke at a forum in Moscow. He made a big claim. He said that Russian scientists are close to creating vaccines for cancer and that they could soon be available to patients.
We have come close to creating so-called oncovaccines, vaccines against cancer, and a new generation of immunomodulatory drugs. And I hope that soon they will be effectively used as methods of individual therapy. Of course, there are many bright discoveries now, and we are looking forward to such discoveries in the future.
Putin did not specify which types of cancer the vaccines would target or how. The news is already making headlines the world over. Cancer is a leading cause of death worldwide. It accounted for nearly 10 million deaths in 2020. That's nearly 1 in 6 deaths. The most common causes of cancer deaths are lung, colon, liver, stomach and breast. Both men and women are at risk of cancer. In fact, the cases are nearly equal among both. Of the total cases in 2020, 9.3 million cases were in men, while 8.8 million were in women. Even children are at risk. Each year, approximately 400,000 children develop cancer. Cancer is a global crisis. So why doesn't it have a cure yet? That's because cancer is a complex disease. Every cancer is caused by the growth of tumors, which have different mutations. And every tumor has its own unique mutation. So a drug that works on one cancer patient may not work on another. On top of this, tumor cells have different mutations too, meaning a treatment can kill one type of cell in a tumor, but others survive. So the tumor grows again. In simpler terms, cancer cells are really good at staying alive. But early detection reduces the spread of cancer, which is why cancer vaccines offer hope. Doctors across the world are developing vaccines that can treat and kill cancer cells and reduce the risk of it coming back. Russia is currently developing one such vaccine, so is the UK. Last year, it signed an agreement with Germany-based BioNTech to launch clinical trials for cancer treatments. The aim is to reach 10,000 patients by 2030. Pharmaceutical companies are also part of the vaccine race. Moderna and Merck are the big names here. They're developing experimental cancer vaccines, and their target is melanoma, the most deadly skin cancer. The development is at a mid-stage. And so far, the vaccines have cut the chance of recurrence or death by half after 3 years of treatment. Meanwhile, some cancer vaccines have seen bigger success. There are currently 6 vaccines against human papillomavirus or HPV. This causes many cancers, including cervical cancer. There are also vaccines against hepatitis B, which can lead to liver cancer. So progress has been made. But cancer is a tough enemy. Different cancers cause over 200 known diseases. So a fight against them is going to be a long one, but one worth fighting.
From impeachments to inaugurations, if it's a political story, we are on the scene. The race for the White House is heating up.
We're beating Biden.
How dare he say that?
If it's breaking news, we're live with the latest coverage. From the White House, the State Department, and Capitol Hill, we know the issues, but above all, we know the players to bring you the latest in-depth analysis on all the key stories that we're covering. I'm Eric Ham. Join me from Washington here on First Post America.